I'm Teresa Youngkin, founder and CEO of Mosaic Life, an AI-driven wellness app, and I'm also a health informaticist. So last week, I attended the CAQH Connect 2024 conference. It was a great mix of payers, providers, and vendors that were talking about the opportunities in today's data-driven environment. The conversations were great. CAQH brought together a group that had 2 days to talk about all the things that were on their mind. Value-based care was a topic of conversation that I heard everywhere. So I wanted to bring back some highlights from the conference for you. Key themes that we heard were about interoperability, data governance, and AI. Of course, it's 2024. We need to have those three things if we want to have effective value-based care programs. So we're going to focus on those foundational building blocks to help us draft, create, and implement value-based care arrangements. Key themes that I heard and the three top areas of discussion in every single session that I attended: interoperability is a catalyst for transforming change in healthcare. So the different sessions that I attended, they talked about the need for a unified approach to data exchange and how we can communicate between payers, providers, and patients. And that also needs to be uniformed. We need to be communicating the same message to each one of our trading partners. Interoperability was framed as a key enabler for better care delivery, for reducing administrative burden, and for having a more efficient healthcare operation. The second thing that we heard was data governance and data quality as pillars of healthcare innovation. There was a significant focus on creating robust data governance frameworks. Why? Because we need to ensure data accuracy, data integrity, and compliance with the standards that we're exchanging data, like HL7's FHIR. Discussions also talked about why data quality helps us to achieve interoperability goals. And when we can get interoperability goals right, that will enable better, more useful real-time clinical decision making. The third area, having to integrate AI to drive efficiency and personalization. AI was on everybody's tongue in everybody's session, and it was discussed so many times. You can see how many tick marks I created on this piece of paper every time I heard the word AI. We have to have AI if we want to enhance our data utilization and predictive analytics. AI is going to help us streamline administrative processes, and it's also going to help us to improve patient engagement. Three main themes that I heard. We have to break down data silos, and we can do that with interoperability and data exchange. Think about leveraging FHIR APIs, avoiding redundant services. These were presented as pathways to a vision. Elevating data quality and data governance. Cross-functional data governance committees need to be able to align on data standards and ensure data quality. This has to be a culture of data accuracy that we are bringing to our organizations. AI has an evolving role in healthcare. What we develop today in 2024 is going to be vastly different than what we develop in 2030. Right now, AI's ability to understand and to process unstructured data, that's a game changer for healthcare operations. Many of the speakers talked about the practical uses of AI in managing chronic conditions, enhancing population health management, supporting clinical decision making, things that we've talked about before. And a shout out needs to go to the moderators of each one of these sessions. Not only did they drive great interactive discussions, the thing that they did that I thought was brilliant was that they asked every single person who was on stage or presenting to give the audience practical steps that organizations could implement within the next 30 days. Number one, conduct an interoperability readiness audit. Identify the gaps in your data exchange, particularly FHIR, and then create a plan to adopt these necessary standards and APIs. Number two, establish a cross-functional data governance team. Make sure that you've got representation from IT, clinical, compliance, business, marketing, sales, because you're going to need these to help you define your data standards, to align on that terminology, and to set up a process that works for everybody in your organization for continuous monitoring and improvement of your data quality. Because as we heard, garbage in, garbage out. And finally, if you haven't heard me say this once, you've heard me say it 1,000 times, pilot an AI-driven use case. Choose one thing to focus on, efficiency or engagement. Choose a project that's manageable. If you're already working on hospital readmissions or you're working on a prior auth project right now, use AI. Figure out how you could use AI to streamline your operations to support those clinical decisions. I also heard a great piece of advice in one of the sessions, and that was do not be an edge case killer. Just because you can't use AI for one part of your project, don't throw the baby out with the bathwater. Use AI where you can use AI. Get small wins and build on those small wins because small wins equal to big wins. Finally, always track those outcomes and adjust your strategies as needed in these pilots. It's not a once and done. Just don't do it and walk away. Make sure that you have a continuous learning healthcare system and learning environment. I had a great time this week at CAQH Core. Thank you so much for inviting me to be a part of that. Shout out to all of the people that put on one spectacular conference. I will see you guys here again next week. We are going to continue to talk about value-based arrangements, FHIR, and AI, because when we layer these technologies, we all win.